I'm Jordan Green, and the purpose of this guide is to provide a treatment program for borderline personality disorder by the use of dialectical behavior therapy, also known as DBT, and mentalization-based therapy, also known as MBT, as a supplemental treatment approach. For this first part, I'm just going to give a definition of borderline personality disorder and explain it a little bit more, and give a brief overview of DBT and MBT, and then in future sections of my paper, a further, more in-depth explanation of DBT and MBT is given. So to begin, borderline personality disorder is a personality disorder indicated in the DSM-5 and is characterized by unstable moods, behavior, and/or relationships. Those diagnosed with borderline personality disorder often struggle to regulate emotions and thoughts, demonstrate impulsive and reckless behavior, and engage in unstable relationships with other people. Furthermore, borderline personality disorder often co-occurs with other disorders such as major depressive disorder, bipolar disorder, anxiety disorders, substance abuse, eating disorders, post-traumatic stress disorder known as PTSD, narcissistic personality disorder, antisocial personality disorder, self-harm, and suicide attempts. So the DSM-5 defines borderline personality disorder, which is also known as BPD, as a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning in early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. So what I'm about to list is just the criteria for meeting a borderline personality disorder diagnosis. So the first one is frantic efforts to avoid real or imagined abandonment. And with that being said, that's pretty much saying that these people are very sensitive to environmental circumstances. They experience intense abandonment fears and inappropriate anger when faced with realistic time-limited separation or when there are unavoidable changes in their plans. And so because of this, they may believe that they're being abandoned because they are bad, and it's related to the intolerance of being alone and need to have others with them. The second criterion is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So that's pretty much saying that the BPD client may at first idealize someone, demand to spend lots of time with them and share intimate details with them, and especially in relationships, early on in relationships, but they may flip in a way quickly and begin devaluing these people, as they may fear that the other person does not care enough or does not give enough or is not there enough. So then the third is identity disturbance. And identity disturbance is characterized by marked and persistently unstable self-image or sense of self. So it may be sudden and dramatic shifts in self-image characterized by shifting goals, values, and vocational aspirations, sudden changes in opinions and plans about career, sexual identity, values, and friends, and also they may suddenly change the roles in their relationships. So then the fourth one is impulsivity in at least 2 areas that are potentially self-damaging. So that pretty much is saying the impulsivity that is potentially self-damaging being things such as gambling, spending money, irresponsibility, binge eating, substance abuse, engaging in unsafe sex, or driving recklessly. The fifth one is recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. So usually those diagnosed with BPD display recurrent suicidal behavior and threats and self-harming behavior as well. And what's interesting about this is that suicide actually occurs in 8 to 10% of all borderline personality disorder clients. And the self-harming behaviors are usually precipitated by threats of separation or rejection or expectations that are not met. And the sixth is affective instability due to marked reactivity of mood. That's pretty much saying that the basic dysphoric mood is often interrupted by periods of anger, panic, or despair, and is rarely relieved by periods of well-being or satisfaction. And then the seventh is chronic feelings of emptiness. And that's pretty much saying that the client is troubled by these chronic feelings of emptiness, and they may be easily bored, may constantly seek something to do, and it causes a lot of problems for them. And the eighth one is inappropriate, intense, or difficulty controlling anger. And that's pretty much saying that they may display extreme sarcasm, bitterness, or verbal outbursts at inappropriate times. And then the ninth one is transient, stress-related, paranoid ideation or severe dissociative symptoms. So that's saying that there may be periods that occur that most frequently in response to a real or imagined abandonment, and the symptoms tend to be transient, lasting for minutes or hours. Real or perceived return of caregivers' nurturance may result in the remission of these symptoms, though. And then from there, those are just the criteria for meeting a BPD diagnosis according to the DSM-5. Also, according to the DSM-5, individuals with borderline personality disorder may have a pattern of undermining themselves at the moment a goal is about to be realized, may develop psychotic-like symptoms during times of stress, may feel more secure with transitional objects, may experience recurrent job losses, interrupted education, and or unsuccessful relationships. So it is important to note, however, that the presentation of borderline personality disorder may vary from person to person. Borderline personality disorder is often treated with some form of psychotherapy and or medications. For the case analysis of BEV, which I explain in my written paper, the treatment approaches that will be explained and used are dialectical behavior therapy and mentalization-based therapy. So now I'm going to give you a brief overview of dialectical behavior therapy and mentalization-based therapy. So to begin, dialectical behavior therapy is a modified form of cognitive behavioral therapy. And it was originally developed by Dr. Marcia Linehan as a treatment approach for those suffering from borderline personality disorder. And DBT primarily aims to validate the experience of the client, treat the client's self-harm or suicidal urges, increase the client's compliance, foster the therapeutic alliance, and focus on process of acceptance and change. And that's the idea behind the term dialectical, is that it's a combination of accepting the client as they are, but also encouraging change within them. And it's largely comprised of emotion regulation, distress tolerance, improvements in interpersonal relationships, and mindfulness training. It also oftentimes is a long-term therapy approach that involves at least 1 year of individual therapy and group therapy for practicing learned skills. In the treatment process using DBT, more productive behaviors and responses are learned along with mindfulness meditation, muscle relaxation, and breath training. And I found dialectical behavior therapy to be the best primary approach for treating borderline personality disorder, as there's an abundance of evidence to support its effectiveness. And not only that, but it was originally created for the sole purpose of treating those with borderline personality disorder. So if you put it into perspective that this therapeutic approach was created for that, it should theoretically work the same. Now I'll go on to mentalization-based therapy, which throughout my paper I use this as a supplemental approach, and so there's a lot more in the paper about dialectical behavior therapy, especially in the case of BEV as well. But mentalization-based therapy aims to promote thinking about one's own mental states, others' mental states, and relationships. So from the perspective of MBT, the core issue that presents with borderline personality disorder is a deficit in the ability to mentalize and or reflect on one's own experiences and mental states. So the goal of mentalization-based therapy for the treatment of borderline personality disorder is to help clients improve their capacity to think about intentions and motivations by increasing conscious awareness of previously inchoate affective states, thus promoting satisfying interpersonal relationships, heightened tolerance of distress, and reduction in impulsive, destructive behaviors. So based on my research, I found mentalization-based therapy to be an empirically supported treatment for borderline personality disorder as a standalone treatment, as well as a supplemental or adjunct treatment to combine with other forms of treatment. And also just wanted to note that mentalization-based therapy, much like dialectical behavior therapy, was developed originally for the treatment of borderline personality disorder individuals. So pretty much, I just gave you a brief overview of what borderline personality disorder is, what dialectical behavior therapy, and what mentalization-based therapy are as well. And additional and more in-depth information on borderline personality disorder is provided in the sections in my paper. And in those sections, you will find demographic information, how to assess a client that may have borderline personality disorder, clinical issues and concerns, treatment approaches for borderline personality disorder, and other relevant information. And pretty much I go into a lot more detail in my paper, so please reference that.